when your passion and your purpose come together, it's so motivating, and I think that's where you can achieve tremendous results. Whenever I worked on the clinic and started building up the different components, to me it didn't felt work. I mean, 10 hours working in the clinic to me almost felt like a it's like a time was just flying by. You're in that flow state of doing what you're passionate about, but then doing it with a purpose for the organization, and helping people to connect really the challenges that we're facing in that country. So
Hey guys, welcome to Keep On Pushing Stories, the podcast that celebrates the indomitable spirit of the human being. Let me start it again. Sorry, guys. Welcome to Keep On Pushing Stories, the podcast that celebrates the indomitable spirit of humans. I'm your host, Devon Harris, and each week we bring you incredible stories of persistence, perseverance, growth, triumphs, resilience. Life isn't about staying comfortable. It's about pushing boundaries and overcoming the obstacles that come our way. And today, I am really excited to welcome my friend Michael Hemling, who is going to share one such inspiring story. Michael, welcome to Keep On Pushing Stories.
Hello, Devon. Thank you so much for having me. It's really like an honor to be here. And my name is Michael Hemling. I'm the Chief of Financial Donor Reporting for the World Food Program here in Rome, Italy. And I've just transferred to Rome from Malawi, where I spent the last 5 years. I was the head of resource management. And the one thing what I started in Malawi is to really be able to match my passion for wellness. I'm passionate for personal wellness, for organizational wellness, and I'm also a certified Chief Wellbeing Officer. And I want to talk a little bit about when your purpose and your passion are coming together and what magic that can create. And I mostly can be found these days on LinkedIn. I'm really focusing on sharing my leadership contents on Michael Hemling on LinkedIn.
Yeah, awesome. So, your purpose, your passion, wellness, and if we want to find you to get some of that, some of those gems, we go to LinkedIn, right?
Yeah, I mean, I'm publishing like a weekly newsletter, so a lot of wellness stories when they're linked to leadership and organizational wellness are in my newsletter.
Okay, awesome. Thank you for that. So one of the questions, or the main question we yearn to ask and to learn about, Michael, is the keep on pushing stories of our guests. Would love to hear of a time in your life when you had to push past a significant challenge, step out of your comfort zone to accomplish something or to move forward. So please do share that with us.
Yeah, no, thank you so much, Devin. Probably one of the most impactful stories which I have in my life just recently happened a few years ago. And when I transferred to Malawi, which was in 2019, I started joining the wellness committee there and as part of my responsibilities as head of resource management. And I really put a lot of effort into it in terms of contributing, like educating the staff in Malawi. It's about 200 staff which we had there. And I created a forum which I called Wellness Hour, and every month we would talk about health issues, wellness issues. And in the beginning of 2020, when I saw that the world is changing and that there is a major health development in China, I started talking to the team and to the staff, and invited WHO and invited a number of UN agencies in really to educate ourselves. What is COVID? Like, what does it mean? Will it have an impact on us? What do we need to be careful? And little that we know is really just a few months after that, we saw like a major impact of COVID in Malawi. And I should also say that Malawi is probably one of the poorest countries in the world, with one of the the most challenging healthcare capacity. I mean, you have a country of about 20 million people, and you have about 600 doctors in the whole country. There's a total in the whole country of about 15 trained surgeons, and very, very little capacity in terms of hospitals. So you can imagine the impact COVID had on Malawi, with no vaccine on the horizon for many, many years. And it was really devastating to see this on the population, but it was also devastating to see this to the UN staff, which is there to serve and support the most vulnerable people in Malawi. So we really tried, as the World Food Program, tried to better understand, well, how can we stay? We don't want to leave the country, which some organizations would do and would send their staff to the capitals for vaccinations. But we said, well, this is the moment where the people of Malawi need us the most. Like, how can we stay? So we started a COVID clinic. So the UN came together, and we created a hospital, and we brought in equipment, we created ventilators, and really started to stabilize people and their families. We would evacuate people to other countries, mostly to Kenya for further treatment, and try to save as many lives as we could back then. And the one thing which then came up in my mind is saying this, well, in the context of where we operate in Malawi, like we're focusing a lot on COVID, which is the most pressing issue right now. It's back in the middle of 2020. But how about all the other diseases? How about HIV? How about tuberculosis, malaria? How do we help the people to support their families and themselves for that? And the idea then came up as to create a non-COVID clinic and really create a safe space for the staff and their families to get treatments for everything else. Because if they would go to a regular hospital, then they would be overcrowded with COVID cases, and the risk of contracting COVID would be extremely high in that context. So we looked into this, and in the World Food Program, often when you have an idea, you're also then going to be the one who has to implement the idea. So my management said, it's a good idea, see what you can do about this, and in the context of all the complexity. And they basically showed me a conference room which had 2 tables in it and 6 chairs, and says, here you go, take that space and make it into a clinic. And that was the direction I got. And the thing is, up to that point, the only thing I knew about clinics was, well, I went to the doctor, I would visit the doctor as a patient, but my background is mainly finance, and I come more from a financial background. And I really had to get my head around, like, how can we, in a very short amount of time, put a structure together which then can function as a clinic. And I really started reading up on it, and probably by now hundreds of books in terms of health, wellness, clinic management, and I started hiring together with the HR team. We brought doctors on board, we brought nurses on board, whoever most talented we could find, we would bring in. We would bring in a consultant company which is specialized in building up medical structures and building up clinics, and we brought in all the equipment that we needed to operate a clinic. And then I would say within about 4 months of time, very, very short time frame, we were able to register the clinic in a very basic sense, but we registered the clinic as an official clinic complying with medical regulations in Malawi based on the Medical Council of Malawi. And it was kind of like the starting point. And we really started helping our staff eventually then to get the COVID vaccine. And we were able to vaccinate 98% of our staff. And we really continued, as your podcast, we kept pushing and seeing what can we do more and what can we really do to help people to get more healthier. So we kept running a lot of medical programs. We kept expanding our vaccination programs. We became one of the first clinics globally which started vaccinating on malaria, and we started vaccinating small babies with a new malaria vaccine, and really start pushing our edge in terms of what can we do in the context of Malawi in really helping people to get better. And but I think what made the most impact is that we started the program which not only looked at the medical side, but also at the preventive side. And we said, how can we really engage our staff to exercise more, to sleep better, to have better nutrition, to manage their stress better, to get mental health support. So really start building all these different programs. And for me, one of the most important aspects of the clinic was we want to make it as impactful as possible to the staff, which is serving the most vulnerable in Malawi, as well as their families. And we want to make it for free. So the only thing we want to do to staff is to book an appointment, go to the doctor, get the medicine, get the laboratory test, and then get healthy and get better again. Everything else, the challenge was, let's take care of everything else as a clinic. And we were able to manage this, that for all WFP staff, it basically was for free. It was very easy in and out, appointment based only, and we started to keep running the clinic. And the word then got out, and we became more and more popular, and eventually we were able to get all the UN agencies. There's 17 agencies in Malawi, and we got all the agencies on board. And we then, I would say, like a year and a half later, after that, we became the first UN clinic for WFP. It's the first clinic which WFP is managing as a whole UN clinic. And really, but we continued pushing forward. And really, for me, I'm still so passionate about, like, well, what's the next step? What do we do to make more impact, to become more impactful as a clinic? And we kept improving on our wellness programs. We kept improving on the medical programs. And then for the last 2 years, we became the best field clinic of WFP. I mean, WFP manages about 26 clinics, and we're on top of our game in terms of medical, in terms of wellness support. But we still kept moving one step, because I said, well, what's the next step after that? And the holy grail in the UN, Devon, is really to achieve the UN quality standard. It's called the HQPS, and it's like geared towards the quality standards of American clinics. And we said, well, what would it be if we take a country like Malawi with a very challenging infrastructure on medical care, and we work on implementing that healthcare standard, which no field clinic by that time has achieved. And we just, a few months ago, we just achieved that as the very, very first UN clinic globally in the entire UN system of about hundreds of UN clinics to achieve that quality standard.
Indeed. So, wow, there's so much to unpack here, Michael. Let's go back a little bit. I'm feverishly taking notes, but let's see how well. So you were able to vaccinate 98% of your staff. Are these expats, or are these was your staff made up of Malawians as well?
Yeah, I mean, the majority of our staff are Malawians. I would say about 85% are national staff in Malawi. And we really made it an effort to be inclusive as we possibly could. There's some boundaries to that, because when you run a clinic, there is a lot of medical liability, and there's a lot of medical insurance and liability insurance for the doctors. So even though in my heart I wanted to extend it to all 20 million people in Malawi, we really tried to capture how far can we get. But we got it to the point that we captured all staff, international as well as national staff, and their families. So all their families, all their children, all their spouses will also be able to get the same treatment.
Right. So you clearly were able to have a significant impact during COVID in that demographic. How was the impact? How were you able to serve a wider community outside of your staff?
Yeah, no, one of the things which was also quite important to us is that we really don't look at our staff and look at the UN, but see what can we do as a clinic with all of our international capabilities, all of our knowledge, all the doctors we brought in. How can we serve the communities? And we started implementing a lot of projects. We started a lot of partnering. Like, for instance, we started partnering with the clinic of the refugee camp in Malawi. There's the Dzaleka refugee camp, and we started supporting them. We donated medicine, we donated our expertise, we trained the doctors there. And I mean, it's unimaginable the needs there. I mean, we literally would go to the refugee camp, and the moment we donated the medicine, it would straight went into the hands of the refugees in that camp, because there was so little medicine available, and we really started to support as much as we can.
Yeah. So COVID-19, it's some at this point, 2025 is a little bit in the rearview mirror. It's hard to believe because we were so consumed by this pandemic. And here it is that you're in a country with very little resources, dealing with a virus that was new to all of us. And it was creating so much chaos and obviously so much danger, so much death. But you had to now figure a way to adapt. And I know you, as you mentioned earlier, you write a lot of articles about wellness and leadership and so on and so forth. So talk to us a little bit about that, Michael. This idea that you didn't know how to, you had no experience in setting up, running a clinic. You had no resources to do so. You had a room with 2 tables. And sometimes we find ourselves, whether in our personal or business, professional lives, where we have no knowledge, little to no resources, but yet we have to create something remarkable. Lead us through the mindset and the process that you used to get to where you are now.
Yeah, no, absolutely. And I think that's one of the things I really admire most about the World Food Program, because the World Food Program, when there is a challenge, then the World Food Program is stepping in and trying to solve the challenge. I mean, one example also was that at one point in COVID, in particular in Africa, there was no more airlines are flying. All the airlines were shutting down, and there was no way to get around. And WFP then said, okay, for us, it's not constraints. For us, it's an opportunity to see how can we solve this. So WFP started chartering planes, and probably at one point was the largest airline around the globe, because we kept running all these planes to deliver the food, to bring in the food, to bring in staff, to move staff around, to support the different countries. And I think that's something with the same mentality here when we looked at this clinic. I mean, certainly it was not myself who did it, but it was a huge, large team. And I think the one thing I learned about wellness, and I learned about medical structures, is that it's all about people. It's about people who are motivated, people who are passionate, and people who can see the impact their work is making, in particular for doctors and for nurses. I mean, it's really admiring to see the extreme hours they're putting in to save lives and to really make an impact on people's health. And so it was really about teaming up and really about connecting. I mean, certainly my biggest thank you probably goes to our medical director in Rome, Dr. Sergio Arena, and his team, because they really stepped up. They were able to connect us to resources. And I mean, as you can imagine, medical care is quite expensive, and it's quite resource heavy in terms of buying equipment and moving a lot of medical staff in and out. But it's really about connecting a team and constantly sending the message that here we're doing something to save as many lives as we can.
Yeah. So when you're dealing with a challenging situation, you find yourself in a really tough environment, a set of circumstances. How important is that mindset of, it's not constraints, but opportunities in order to move forward?
Yeah, no, I think it's very important, and certainly that's something which takes time to learn. But I think it's also within the culture of the World Food Program is to look at challenges as opportunities, because often we as a World Food Program, like, we're the first responders to cyclones or to earthquakes or to a significant crisis in that country, and there's very little time to mourn or to think of or to take the tragedy in. But it's really about focusing, well, how can we turn the tragedy into something that helps people and that saves as many people as we can.
Yeah. To kind of, I guess, in a way, meander a little bit of, the subject of persistence and dealing with challenges and so on, although it's connected, programs, organizations like the World Food Program and, the work that the UN does on a whole can sometimes seem like become a political lightning rod, actually. And here in the United States, there's been a lot of conversations about whether we should support those organizations or we shouldn't. Explain to us, you just mentioned that when there's a natural disaster, the World Food Program is there without even absorbing the human tragedy, just dealing with providing the support that people need. Can you enlighten us a little bit, Michael, on how important it is to support these organizations?
Yeah, no, I think it's very important that people, and in particular for the World Food Program, that donors understand the impact that we're making on people's lives. And I think when it comes to the mission of the World Food Program, there is a lot of consensus that bringing food to people and helping people to feed themselves and to be able to get over catastrophe is really helping the situation globally and helping not only countries to survive and to thrive, but really makes an impact on global stability and eliminating food insecurity. So my experience is that there has been really broad support to the mission of the World Food Program, because it's really critical that no matter what the background and the political view is, that food is always at the center of the conversation. And if we can help people to feed themselves or help people to support themselves and provide food support, I think it solves a lot of challenges.
Yeah. So COVID-19 hits. You are in Malawi, a country with very little resources. You're dealing with really a rather overwhelming challenge of dealing with this, managing this disease. You start a clinic that vaccinates 98% of your staff and their families. And then you didn't stop there. You went on now to administering and dealing with HIV and tuberculosis and malaria, to the point now where your little field clinic that started in a conference room with 2 tables and a couple of chairs is now recognized as achieving the standards of that's set here in America for a medical facility.
Yeah.
What are the biggest lessons you've taken away from that experience?
Yeah, no, I think the biggest lesson to me is that when your passion and your purpose come together, it's so motivating, and I think that's where you can achieve tremendous results. I mean, for me, in Malawi, I was managing 7 different teams. I mean, from finance, administration, security, information technology, and so on. And whenever I worked on the clinic and started building up the different components, to me it didn't felt work. I mean, 10 hours working in the clinic to me almost felt like it's like time was just flying by. You're in that flow state of doing what you're passionate about, but then doing it with a purpose for the organization and helping people to connect really the challenges that we're facing in that country. So I think if you have something like this, and I'm sure on your podcast you have a lot of people who are driven by their purpose and who are passionate about what they do. And I think if you have that, then time is almost like of no matter, because you see the goal and you look at the next goal after that. And if you have a great team, because to me healthcare is all about people. It's all about how do you motivate people. I mean, the thing is, I'm not a doctor, I'm not a nurse, I cannot administrate any medical help. I mean, I didn't went to that education, but as a leader, I can give doctors and nurses the tools. I can give them the space to do what they do the best. And I think that's for me as a leader, the most rewarding aspect of it, that I can motivate people, that I can help people to do their job and connect the team so that in the end it all moves into the best possible direction.
What a beautiful way to end this conversation, Michael. I'm going to call it the 3 Ps, passion, purpose, and people. You need that passion to connect to that purpose that drives you to get amazing things done, and it doesn't feel difficult, and it's not like you're not making effort, but to use your term, you find yourself in this flow state. And of course, none of us can ever do it by ourselves. So, having a team, having people around you to help you execute and make a difference, make an impact, is really what it's all about. Truly a story that epitomizes the keep on pushing philosophy. One that, deals with challenges head on, not seeing constraints, but opportunities, working through it through your passion, your purpose, and connecting with people to make a difference, make an impact around the world. We applaud you for that. Applaud you for that work, Michael, and wish you just continued success as you continue to make a difference around the world.
Yeah, no, thank you so much, Devin. I mean, I think it has been such a great pleasure to talking to you and to be able to share the story. And I wish you really the best, and looking forward to many more keep on pushing stories. Thank you.
Indeed. Guys, if you enjoyed this, if you found it valuable, please don't forget to share it. And of course, drop us a like, because there will be many more amazing, inspirational, motivational stories just like this one. Until we connect next time, yes, you know what to do. Keep on pushing.